Did you know that Center for Disease Control, or CDC, has estimated that 1 in 68 children have been identified with autism spectrum disorder, and that it is almost 5 times more likely among boys than girls? 1 in 42 boys versus 1 in 189 girls. Parents and these children need help, and that's exactly what Southwest Autism Research and Resource Center was established for, to provide support for those families with autism. Southwest Autism Research and Resource Center, or SARRC, is a nonprofit, community-based organization in Phoenix, Arizona. This is dedicated to research, education, and resources for individuals with autism spectrum disorders. Today I'll talk to you about the history of SARRC, explain what autism is, what they do to advance children with autism, the types of research they do, and lastly, the different types of programs and therapies they offer. SARRC all started with 2 committed mothers of children with autism and a doctor who endeared their children. These 3 incredible people quickly expanded and outgrew their table at Paradise Valley Coffee Shop where they had met. It was here that Ron Melman, Denise Rensick, and Cindy Schneider really took off with SARRC. They first started out of their homes doing all sorts of research. It quickly picked up momentum, and in just over 18 months, these 3 opened their first facility in 1998. During its 5th year of operation, more than 1,800 parents, paraprofessionals, teachers, and therapists enrolled in the center's workshops and training sessions. From here on out, SARRC only soared and grew into the huge organization that they are today. Now, you may be wondering, okay, what exactly is autism, and why is this so debilitating? Well, I'll tell you. Autism is a brain disorder that often makes it hard to communicate with and relate to others. With autism, the different areas of the brain fail to work. Symptoms of this disorder may include a delay in learning to talk or not talking at all. Also, a child may seem deaf even though hearing tests are normal. Another symptom would be a repeated and overused types of behavior, interest, and play. Examples of this would be repeated body rocking, unusual attachments to objects, and becoming upset when routines change. Most people with autism have trouble relating to others, but early diagnosis and treatment have helped more and more people who have autism reach their full potential. This is exactly why SARRC is so great, because they offer different programs to both adults and children with autism. Programs that will help advance people with this disorder. These programs include a clinical program. These rely on evidence-based practices and intervention characteristics, and include a framework of core intervention components. School-based autism services is another program. This program focuses on supporting students in inclusive education programs and or transitioning students from special education to general education placements. Then there is vocational and life skills. This was established by SARRC to maximize the independence, productivity, and quality of life of young adults and adults with autism. Lastly, there is Autism Community Works. This provides an inclusive environment for teens with autism and peer mentors to volunteer in dozens of nonprofits. In just a few years, these teens have donated more than 30,000 hours of volunteer service to 35 nonprofit organizations. Research, research, and more research. SARRC is all about their research. It brings together many methods and scientists in an effort to gain greater understanding of possible causes of autism, to identify better treatments, learn how to prevent it, and ultimately find a cure for those affected by autism spectrum disorder. SARRC's research team is led by Christopher Smith, an experimental psychologist. As Vice President/Research Director, Dr. Smith is developing a large-scale autism family study to aid in the identification of genes that are associated with this complex disorder. Other past studies have been things like a study on core symptoms of autism change with age and another on regression in autism disorder. These are just among the many different studies performed at SARRC. As you can tell from the information I've told you about Southwest Autism Research and Resource Center, this is the answer to families who are dealing with autism spectrum disorder in their homes. This organization would not be here if it weren't for Ron, Denise, and Cindy. Because of their want to support and help others deal with this disorder and ultimately find a cure, they've helped countless people on their journey. This nonprofit organization is the opportunity for families to find the help they've been looking for. Thank you.